Next question is identify the body plane. So this plane was asked in your Neet Mds entrance exam. So this plane is the transverse plane. So the transverse plane is a horizontal line that divides the body into the upper section and the lower section. So that's the transverse plane. Another plane is the coronal plane. So this plane is the coronal plane. So it is a vertical line that divides the body into the front section and the back and the posterior section. So it divides the body into anterior and posterior segment. So there are three planes: transverse plane, coronal plane, and other one. This one is the sagittal plane. So the answer is a transverse plane. Moving to the next question. Characteristic feature of Hurler syndrome is, well, we know Hurler syndrome. It is also known as mucopolysaccharidosis type 1. So it is, remember, it is a rare metabolic disorder belonging to the group of diseases that are known as mucopolysaccharides. So it is a autosomal recessive disorder. So it is an autosomal recessive disorder that occurs due to the deficiency of enzyme. That is what you have to remember for exam point of view. It is due to the deficiency of alpha L udoronidase enzyme. That is essential. This enzyme, remember, it is essential for breakdown of complex carbohydrates that are known as glycosaminoglycan. So individual with the Hurler syndrome would lack or have reduced level of this enzyme. So this enzyme, it helps to break down two types of glycosaminoglycan. What are those? One is the, remember, is the heparin sulfate, and other is the dermatan sulfate. So due to the enzyme deficiency, there is accumulation of glycosaminoglycans in various tissues and organs throughout the body. So this accumulation leads to damage and dysfunction of these tissues. Now let us move to the clinical features. First of all, you can see is the skeletal abnormalities. Like the patient, he may exhibit skeletal abnormalities like the patient may have a short height, joint stiffness, and multiple abnormal development of bones. Apart from that, you may see facial features like broad nose, thickened lips, etc. Apart from that, the internal organ, including the heart, liver, and spleen, they may be enlarged. One of the most important feature is you will see is the corneal clouding. So this is the one that was asked in your recent NEET exam. So you will see clouding of the cornea. That is the characteristic feature. So this clouding would affect what? This would affect the vision. Apart from that, you can see is cognitive impairment. Intellectual disability is common in individual with the Hurler syndrome. The symptoms, they become more apparent in the early childhood. The progression of disease leads to increased disability and shortened lifespan. Now, how can you diagnose this? Diagnose is usually based on the clinical features. You can measure the enzyme activity and the genetic testing. So for the MCQ part, the characteristic feature of Hurler syndrome is corneal clouding. That's your answer. Moving to the next question. The calcified canal is detected. The diagram depicting the champagne bubble test it is used for. So that is used for the sodium hypochlorite. So champagne bubble test, it is used in the context of locating, remember, locating calcified root canal orifice. So what you see is the tiny bubbles. That appears in the solution, indicating the position. So this solution, these tiny bubbles would indicate the position of orifice. So remember, it is best seen during magnification. So therefore, the champagne bubble test with sodium hypochlorite, it is technique that is used to identify the location of the calcified canal orifice during the endodontic procedure. That's your answer. Coming to next question, a patient was bitten with cobra bite. What you see is the hoarseness of voice and patient present with the following. Identify the condition at scene. So the patient symptoms including you can see is the bilateral ptosis, that is the drooping of eyelid. Apart from that, you can see is paralysis of the eye muscle. That would indicate a neurotoxicity. So this would indicate the neurotoxicity that is associated with the following snake bite. As in the patient and in the statement, it clearly says that the patient was bitten by a cobra bite. So the characteristic mentioned in the question is the hoarseness of voice. So the combination of symptoms, it is indicative of cobra snake bite. Now the progression of the symptoms, they are described in two stages. What are those? The first is pre-paralytic. First is pre-paralytic stage, and other one is paralytic stage. Now what you see in the pre-paralytic stage, so you will see vomiting, ptosis, that is preceded by the contraction of the frontalis muscle as seen in this figure. So there is the dropping of eyelid that is mentioned in the question, blurred vision. Apart from that, you can see is the paralysis of the eye muscle. There can be paresthesia around the mouth, vertigo, etc. The second stage is the paralytic stage. So here the facial muscle, palate, jaws, tongues, vocal cord, and the muscle of degglutination, that is the muscle of the swallowing, they becomes paralyzed. The patient may find it difficult to open their mouth and speak. So you will see respiratory arrest that occurs due to the obstruction of the upper airway by the paralyzed tongue, or the patient may inhale their vomitus. So it can also result from the paralysis of intercostal muscle and diaphragm. So ultimately the muscles, they will get paralyzed and lead to difficulty in the breathing. So your answer would be ptosis. Coming to the next question, drug trial on large group of population to check the effectiveness, safety of drug. It is based on phase 3. Now think of the drug development as a step-by-step process, like you climb a ladder. Suppose now the phase 1. So this one is the ladder, and person suppose is climbing a ladder. You can suppose like that. Now let us discuss the phase 1. So this is the first step, like taking the first run of the ladder, like the first step of the ladder. So drug, here the drug, it is tested on the, remember, small group of healthy volunteers to understand its basic safety and how body process it. So it is not about testing efficacy yet. So imagine it checking if a new ladder is safe for use by seeing how a few people climb it. Next come is the phase 2. So now we move up a little bit on the ladder. So the drug, it is tested on the small number of actual patients, that are 20 to around 200, to see its effectiveness and whether it is safe in treating the condition. Now it's like checking if the ladder works well for small group of people who actually need to use it. The third is the phase 3. So here we climb higher on the ladder. The drug is tested on large group of patients at the multiple centers. So this phase, it helps to understand how the drugs works in a diverse population, including different genetic backgrounds. If it proves safe and effective here, it's like reaching a higher step on the ladder. So it is similar to making sure the ladder works well for a wide range of people in a different situation. Next comes the phase 4. So now we are at the top of the ladder. The drug is approved and it is out in the market. The phase 4 involves monitoring the drug safety in the real world situation, looking for any rare or long term side effect. So it's like keeping an eye on the ladder to make sure it continue to be safe for use over a period of time. So remember, phase 3 is like pivot step where the drug, it is tested for large group of patients to ensure it's safe and effective for the widespread use. So the answer would be phase 3. Hope you understand all the phases. So many MCQ can be framed from this, and this topic is important for your NEET point of view. Coming to the next question, bilateral buccolingual expansion of cortical plates are most commonly seen in, the answer would be ameloblastoma. Now the bilateral buccolingual expansion of cortical plates, it is most commonly associated with, remember, it is most commonly associated with ameloblastoma. So on radiograph, you will see rounded, well-defined radiolucency in the bone with a defined soap bubble appearance, especially in the larger tumors with multilocular radiolucencies. So the bilateral buccolingual expansion is a characteristic feature of the ameloblastoma. When the ameloblastoma grows, it tends to expand the bone in both the buccal as well as the lingual direction. So the expansion, it is also described as soft bubble appearance on radiograph with well-defined rounded radiolucent area. So this expansion pattern along the soft bubble appearance, it helps to diagnose the mieloblastoma. Coming to the next question, class 3 malocclusion type of speech defect is labiodental. So remember this table, it's very important for your NEET point of view. So in severe class 3 malocclusion, there you can see if the distortion or interdentalization of the labiodental fricatives, that are the F and V sounds. So this is because a severe class 3 malocclusion can lead to difficulty in producing these sounds due to the misalignment of the upper and the lower incisors. If you remember this table, the speech sound SZ, the problem associated is lisping, and there would you see is the anterior open bite, large gap between the incisors, the lingodental, lingualo-alveolar stops due to the sounds like T and D. So there that is due to the irregular incisors, especially lingual position of the maxillary incisors. Labiodental fricatives, as stated in the question, it is due to the skeleton class 3. And sounds like lingodental fricatives, TH, SH, CH, they are due to the anterior open bite. Now coming to the next question, in cobalt chromium alloy, metal that is responsible for corrosion resistance, it's the chromium. Well, we know the resistance to corrosion can be achieved by making the metal component either too noble to react or by ability of one or more metallic element to form a protective surface film. So what is the role of, remember what is the role of chromium here in this? So in this question, the metal that is resistant, that is responsible to provide corrosion resistance is the chromium. So remember, the chromium has ability to form adherent passivating surface film on the alloy. So this passivating film act as a protective layer. So this passivating film would inhibit any subsurface reaction and prevent further corrosion. So for entrance exam, you just have to remember that what is the minimum chromium content to exhibit passivity and ensure effective corrosion resistance. The cobalt chromium alloy should have a minimum of 12% chromium. So this minimum chromium content, it is necessary to facilitate the formation of protective passivating surface film. Coming to the next question, the strength of the gypsum investment, it depends upon, well, the strength of gypsum investment, it would depend upon the modifiers, binders and modifiers. So binder, what are binder? We know they are the essential component in the gypsum investment. So the type of the gypsum used as binder significantly influence the compressive strength of investment. Whereas the chemical modifiers, we know they are the substances, they are added to investment to improve certain properties. In this context, they are used to increase the strength of the investment. So the presence of chemical modifiers, they allow for more efficient utilization of binder. So the strength of the gypsum investment would depend upon the binders and the modifiers. That would be your answer. Coming to next question, the diaphragma closure of 4 mm corrected in adults, what type of retainer should be used? So here the diaphragma, it's around how much? It's around 4 mm that needs correction. So a fixed bonding retainer, it is a type of retainer that is permanently attached to the back surface of the teeth, typically using the dental bonding. So it consists of thin wires that is fixed in place and it is not removed by the patient. So what are the advantages of this fixed retainer for diaphragma closure? Fixed retainer would provide a continuous, consistent force to keep the teeth in their corrected position. So that is important for the closure of diaphragma. So that would offer the stability, minimizing the risk of relapse or gap reopening over the time. So the removable retainers, uh, they require consistent patient cooperation to achieve effective results. Whereas the palatal crib here, it is typically the primary choice for diaphragma closure. It is not the palatal crib is not typically the primary choice for managing the diaphragma closure. It is more commonly associated with the managing tongue thrusting habit. So your answer would be A, that is the fixed bonded retainers. Coming to next question, identify the cauliflower-like growth with the collagen fibers. So the answer here is irritational fibroma. So irritational fibroma, it appears as a well-defined pale pink papule. So you will see a papule. So you will see a papule as shown here in this figure. So irritational fibroma, it appears like a papule that enlarge to form a nodule. So it is characterized by cauliflower-like growth with collagen fibers. The lesion is smooth, symmetrical, round, firm, and typically painless. So with the irritational fibroma, it is commonly benign, exophytic, in growth. So your answer would be irritational fibroma. So moving to the next question, the patient, he have breathlessness, fatigue, come into clinical observation of oxygen carrying capacity of hemoglobin less, and radiographically you see hair on end showing at skull. So that is indicative of the patient here is experiencing breathlessness and fatigue. That can be indicative of anemia. The observation that the oxygen carrying capacity of the hemoglobin is less suggests that it is an anemic condition. The radiographic finding here on end appearance indicates appearance in the skull. They are the classical features that are associated with thalassemia major. The thalassemia, we know it's a genetic blood disorder that is characterized by reduced hemoglobin production. Thalassemia major, it's the most severe form and is associated with significant symptoms and complications. So the classic radiographic changes in the skull in the thalassemia major, they are the thickened calvarium and characteristic hair on end appearance. So your answer would be thalassemia major. Apart from that, remember the hair on end appearance, it is seen in thalassemia major as well as sickle cell anemia. So the observation of reduced oxygen carrying capacity, specific radiographic changes described point toward the thalassemia major here. Moving to the next question, the most common complication of patient with auricular defect having implant retained prosthesis. Well, the most common complaint of patient with auricular defect and an implant retained prosthesis is often related to difficulty in cleaning and maintaining the hygiene around the prosthesis. So the patient finds it difficult to clean and maintain hygiene. So that is why your answer would be C. So as seen here in this figure, the most common complaint of patient with auricular defect and implant retained prosthesis is related to difficulty of cleaning and maintaining hygiene around the prosthesis. So this challenge, it is commonly associated with prosthetic device in the area where with the good oral hygiene, it is important for the long-term health and stability of the implant related prosthesis. Coming to the next question, the carcinoma lip, all of following statement they are true except the lip cancer, it can become noticeable at early stage, making it detectable in the initial stages. Second, the cancer cells from the lip, it can spread to the nearby lymph nodes early. So lip cancer can spread especially if not detected and treated early. So the cancer cells from the lip can spread to nearby lymph nodes relatively early. The cancer cells tends to spread sideways or laterally, potentially infiltrating into the nearby structures like the floor of mouth, mandible and the maxilla. So the answer would be D, that is no spread. The child accidentally eat 20 tablets of iron and there is acute iron poisoning. What is the drug that should be given? The answer here is A, that is desferoxamine. So in case of acute iron poisoning that occurs when child accidentally ingests a large number of iron tablets, appropriate treatment is very important. Option A, desferoxamine, we know it's remember desferoxamine, it's a chelating agent and it is used in the treatment of acute iron intoxication. So chelating agent, it will bind to the excess iron in the body, forming a complex that can be eliminated from the system. The second option is dafepirone. While dafepirone, it is used to remove excess iron in body, particularly in individuals who have received numerous blood transfusion for conditions like the thalassemia. Option C is acetylcysteine. It is not the appropriate treatment for acute iron poisoning. It is used in case of paracetamol poisoning. So it acts as an antidote. So it is used in case of paracetamol overdose and for the respiratory condition with a thick mucus. So your answer would be A here. Coming to the next question, a 46-year-old female denture wearer presented with small growth of gradual onset on the tongue since 2 years. Identify the lesion. Well, it's irritational fibroma. Irritational fibroma is described as healed end product of an inflammatory hyperplastic lesion. It can occur at any age and from various soft tissue sites with the tongue, gingiva and buccal mucosa. So as the name suggests, irritational fibroma, it results from the chronic irritation or trauma to the oral mucosa. So in this case, the patient being a denture wearer may have experienced repeated irritation contribution to the lesion development. So that is why your answer would be C, that is irritational fibroma. Papilloma, lipoma and giant cell tumor, they are not specifically associated with chronic irritation or trauma and therefore they are not considered as answer. So you have to mark answer C as choice.